Hello students. Today we are going to continue our topic, that is pleomorphic adenoma. Till now we have discussed about the introduction portion of pleomorphic adenoma, their clinical feature and the histogenesis, their origin, how the pleomorphic adenoma originates. These all have been discussed in the previous lecture. So now we are going to discuss in detail about the pleomorphic adenoma, their histological feature and their gross morphology. Today in the gross morphology, what we are going to see, how it appears from the outer side or how it grossly appears is. So let's come to discuss. It's an irregular mass which is ovoid in shape with a well-defined border and the cut surface may be rubbly. What it means is that this tumor will be irregularly in shape. This tumor will have an irregular margin but have a well-defined outline. Means the outline or the boundary which will be present with this tumor will be a well demarcated. You can observe it. So this tumor on the cut surface will look like a fleshy mass, a lump of mass in a rubbery pattern, and they will be mucoid or glistering. Means that they will contain the mucous cells, so they have mucoid appearance, they will have a rubbery appearance, they will have like a, you can see like elastic appearance. Okay, with a homogeneous tan or white color, there will be homogeneous mixture of color and that will be tan color or the white color. So this is the irregularly mass and having a gross morphology like it. Means they will be fleshy ovoid mass or with a well-defined margin, fleshy and rubbery with a tan or white color homogeneous areas. Then the area of hemorrhage and the infarction can be seen in this tumor. Means the area will be seen in this tumor where there will be hemorrhage, where there will be blood clotting, or there will be an area in which there will be infarction can be seen. Now come to the microscopic feature, how it will appear in the microscope when the biopsy is done and we will see in the histology. So in the morphological diversity is very much seen in this tumor. As we have discussed earlier that this tumor is associated with a high level of morphological diversity. So this is the hallmark of this tumor. Means the diversity in the morphology is the hallmark of this tumor. This tumor consists of combination of glandular epithelium plus mesenchymal epithelium. Means this tumor has some epithelium which are glandular and the mesenchymal. These two epithelium is present in this tumor and are in a combination with it. They have a undefined combination. They do not have a fixed combination that this will be 50%, this will be 50%. This is not clear there. But yes, there will be combination of these two epithelium, that is mesenchymal epithelium cells and the glandular epithelium. This tumor will have well circumscribed. Yes, already discussed. As you see in the gross morphology, in the histopathology you will also see that this tumor has a well defined margin. Also this tumor will be encapsulated. This tumor will be encapsulated, whereas in the mucoepidermoid carcinoma, when you will see, it will be not capsulated. Means they will not be encapsulated, and this is the difference between the pleomorphic adenoma and the mucoepidermoid carcinoma. Now come to our topic. Epithelium often forms ducts and cystic structure or like islands or sheets of cells. Means the epithelium, that is glandular epithelium, mesenchymal epithelium, they forms the island-like cells structure. They forms a sheet of structure which is like a duct or cystic structure like pattern, and that will be island-like. A sheet-like structure will be made by those epithelium. Then the anastomosizing cord and the foci of keratinizing squamous cells and the spindle cells. Why this squamous cell and the spindle cell will be seen is because this tumor consists of myoepithelial cells. These myoepithelial cells are spindle in shape mostly. Mostly they are spindle in shape, but they can be angular, round or eccentric with a eccentric nucleus. मतलब क्या हुआ कि ये जो ट्यूमर होगा ये राउंड हो सकता है, they can be irregular margin and they can be spindle shape because the spindle shape cells are mostly present with this tumor and it is a major component of the pleomorphic adenoma. Now, the hyalinized eosinophilic cytoplasm resembles plasma cell. Yes, the cytoplasm with a eosinophilic hyalinization resembles a plasma cell. Now, the myoepithelial cell responsible for mesenchymal changes by the accumulation of mucoid around the myoepithelial cells. What it means? This is an important line from say first. This means is the myoepithelial cell, break these words. The myoepithelial cell responsible for the mesenchymal changes. There are some myoepithelial cells, they are responsible for the mesenchymal cells. Okay? They get changed into the mesenchymal cells and how they change? They change by the accumulation of, they change by the myoepithelial cells के around accumulation of the mucus or the mucoid cells. Once the accumulation of the mucus or mucoid cells occur, they start giving a myxoid appearance. And I have told you in the introduction portion, this tumor is called mixed tumor. Why this mixed tumor? Because of these things. They have mixed appearance, mucoid appearance. Okay? Myxoid appearance are present in this tumor. So this tumor is called as a mixed tumor. Also, there will be vacuolar degeneration. There will be the degeneration of the vacuoles, and so due to the vacuolar degeneration of the myoepithelial cells, the myoepithelium get degenerated. So they gives appearance called cellular appearance. Sorry, chondroid appearance. And we have told that this tumor is also called as Enchondroma. Yes, because of these things. Because there is appearance of chondroid, means cartilaginous appearance is there. So this tumor is called as chondroid Enchondroma or chondroid appearance is seen. Osteoid body cells are also seen. Means there will be the bony appearance body seen. Cells that makes the bone, osteoid bones. Osteoid cells are seen. And that's why these tumors are called as the cellular appearance. The stroma is absent. When there is a stroma absent, absence of connective tissue fiber, a stroma, then this tumor will appear like a cellular appearance. Means there is appearance, there is mixed appearance in this tumor. Once there is mixed appearance in this tumor, you will say that yes, there is myxoid appearance. There is mixed appearance in this tumor, like chondroid body, cellular body appearance, myxoid appearance, and according to all these features, according to Foote and Frasil, they classified this pleomorphic adenoma. They named this pleomorphic adenoma according to their appearance, like the myxoid primary, means the tumor is appearing myxoid only. The primary thing that this tumor can be seen in the histology is the myxoid appearance. Then the myxoid cellular, means myxoid is appearance and the cellular appearance. Both are seen in the histological slide. So the third one is predominant cellular. When it will see predominantly cellular, when the stroma is completely absent. When the stroma is completely absent, you will see that there is a appearance called as predominantly cellular appearance. Because of the lack of stroma, the connective tissue fibers are not present. Once the connective tissue fibers are not present, you will see that the cells are only present in the tumor. Once the cells are only present in the tumor, see in the histological slide somewhere that the cells are only present. And the highly cellular, a time will appear when there is zero stroma, zero connective tissue cells. So that time you will only see the cellular appearance, that is myoepithelial cells, intergalactic duct cells, squamous cells, and that will be seen. Melting growth pattern. This is the most important line when you are writing the exam. What does it mean? Melting growth means from the center to the periphery. When you will see the slide, you will see that there is reduction in the growth pattern, means there is reduction in the cell number, and that is called as the melting growth pattern. And this is seen only in the case of pleomorphic adenoma, which is a benign tumor of salivary gland. Then a squamous metaplasia is seen. In this tumor, area will be visible where you will find that there is a squamous cell metaplasia. Concentration of much more amount of the squamous cells, and that will be the squamous cell metaplasia is seen in this tumor. So this was all about the histopathology, that myoepithelial cells are present, squamous metaplasia are present, gross morphology, irregular mass of wire mass, etc. are seen in this tumor. Now come to the differential diagnosis of this tumor. In the differential diagnosis, there will be oncocytoma, myoepithelioma, mucous epidermoid carcinoma or mucoid epidermoid carcinoma, basal cell adenoma, and the Warthin's tumor. Then come to the treatment plan. In the treatment, you will go for the surgical excision, because this is a well defined margin. You can go for enucleation, but local enucleation should be avoided because there is a chance of damage to the nerve, facial nerve. Peridectomy of deep lobe with a facial nerve preservation. We go for the peridectomy with the facial nerve preservation. Now come to the TNM classification. In any tumor, if you are writing in examination and you write about the TNM classification or a staging of this tumor, it will help you in fetching much more marks. And TNM classification is very important in the case of a squamous cell carcinoma. Yes, see, the staging will be same like a squamous cell carcinoma. There is little difference, and that TNM staging we do is T here stand for tumor cannot be assessed. Means in the T0 you will find, write it down, in the T0 you will find there is no evidence of such tumor. In the T1 you will find the tumor size is less than 2 cm or less in the greatest diameter. So this is the T1. Now the T2, the tumor size is more than 2 cm, the tumor size is more than 2 cm and but less than 4 cm in the greatest diameter. But the T3, the tumor size has increased more than 6 cm or have extraparenchymal extension and without any involvement of the 7th cranial nerve, that is facial nerve, means 7th nerve is not developed. But in the case of T4, in the T4 you will find that the tumor has involved the facial nerve, that is 7th cranial nerve, and also has involved the different nodes and has size more than 6 cm of the greatest diameter. In the N, it represents lymph node involvement, how much the lymph node has been involved, and in the N, it represents N0 to N3. N0 means lymph node cannot be accessed, N1 lymph node can be accessed, N1 A means the lymph node is single lymph node involvement, N2 lymph node is involved but bilateral lymph node involved, and N3 means multiple lymph node has been involved. In the M represent metastasis power and how much the tumor has metastasized. M0 tumor has not metastasized, MX tumor has metastasized, and M1 tumor has metastasized to a long distance. So this was all about the pleomorphic adenoma, microscopic feature and the microscopic feature with their TNM staging. Hope you all enjoyed our video. Links for different notes and different channel where you can contact me is given in our description box, and please do like, share and subscribe to our channel Ocean of Dentistry and press the bell icon for more updates. Thank you. That's all for today.